Hi everybody, Dr. Kaylee Garrett-Zimmerman here, physical therapist, owner and founder of FEM Empowerment and Advocacy. Today's topic is that option C that I gave you on that question from a little while ago, where you got to pick the myth or which one you believe to be the myth, and again it turned out to be all of them. The first myth we talked about from that question was that the pelvic floor only involves the pelvic floor. That is a myth. The second one we talked about is you need to scrub and use heavy soaps for your vagina to bathe it. That is another myth. And this third one that we're going to talk about is that your pelvic floor has nothing to do with your bowels. Now, in the female body, you have a very close proximity of the vagina and the rectum. To say that the pelvic floor does not involve your bowels is to give yourself a disjustice, an injustice. You want to make sure that you are paying attention to the entire body as a whole, as I spoke about on that A option. If someone is constipated and they come to me for a pelvic floor dysfunction, that to me is where I start. You want to start with the bowels. You want to start and make sure that everything, is working appropriately, functioning properly. And if the back side doesn't work, the front side probably doesn't either. They are so close together that you have to pay attention to what you're putting into your body food-wise, drink-wise. You want to make sure that the patient is able to breathe, to perform what they need to perform as far as that goes. You want to be sure that you pay specific attention to your pelvic floor on both ends. And again, the reason I say that is the close proximity. You've got the perineum, which is between the vagina and the rectum, and they're all very close. The muscles, when you contract one, is going to pull a little bit on the other one. You can feel the difference between both sides, but you as a whole should be able to feel them all as a whole. So absolutely, and again, I target the bowel impairments first because that can affect the bladder impairments and that can affect problems with pelvic floor dysfunction. If you have constipation, it can cause a lot of problems with the bladder, whether it's going too much, or you can get retention as well with urine. You can get pain, you can get diastasis problems that progress. If you're having fecal incontinence, that can cause you to have some incontinence of urine. It can cause you to get a lot of UTIs, a lot of bacterial infections. So that is a myth to say that it doesn't involve both ends. The pelvic floor and pelvic floor physical therapy does target both sides of it. And if you have any questions, comments, thoughts, or concerns about that, please let me know.